It now gives me great pleasure to turn the meeting over to the Director and the Co-Director of the Interdisciplinary Nursing Quality Research Initiative, or INQRI. This nurse researcher and healthcare economist share a passion for interdisciplinary work. In fact, they've been research collaborators for over 20 years. She co-chaired the National Quality Forum Steering Committee, which endorsed a set of nursing-sensitive measures, and you've all, no doubt, heard of her interdisciplinary program of research designed to improve outcomes and reduce costs for the elderly. She's the Marion S. Ware Professor of Gerontology at the University of Pennsylvania School of Nursing. He has been published extensively with work focusing on health policy and health insurance. Since 1983, he has served on the editorial board of Public Finance Quarterly. He's an advisory editor for the Journal of Risk and Uncertainty and the co-editor-in-chief for the International Journal of Healthcare Finance and Economics. He's the Bentheim Professor at the University of Pennsylvania's Wharton School. Please give a warm welcome to INQRI's Director, Mary Naylor, and Co-Director, Mark Polly.
Good morning. It's wonderful to see you here and to welcome you, as Lori has, to our fourth annual INQRI meeting. I especially want to recognize our finalists. This is tremendously exciting. About a year's work goes into the selection of the best among the best proposals and teams, and we're tremendously excited about both the nature of the work that you propose and I know the accomplishments that you'll achieve over the next couple of years. I also am thrilled to have back all of our grantees, the members of our National Advisory Committee, and the key stakeholders. Collectively, we're here to try to really achieve and advance the mission of INQRI, which is to establish the causal linkages between nursing and quality. And there is no more important time in the history of this country when we need to be making that case loudly and clearly. So we have designed this agenda, as we do over the years, to accomplish a number of important goals. The first is that all of you, and especially the newest finalist, will have a chance to begin to understand your work in the context of the mission of the Robert Wood Johnson Foundation to improve the health of all Americans. And over the next couple of days, you'll have a chance to hear from a number of people representing the foundation to put this program in perspective. I'm looking over here at Sue Hassmiller. Sue is the lead nurse at the Robert Wood Johnson Foundation, and yesterday, along with, I don't know if Linda Burns-Bolton is here. Hi, didn't get to see you, but the two of them were participants, along with my colleague Mark Pauly, in the launch of a very important initiative based at the Institute of Medicine. And so Sue and Linda Burns-Bolton will be telling you more about that. Tomorrow also you'll have the opportunity to hear from the president of the foundation, Risa Lavizamori, who will talk about nurses' work at the foundation and its importance and relevance to healthcare reform. You also will have an opportunity to spend much more time with each other. So those of you who have been here over the last couple of years have pleaded with us to make sure that we prepare in this agenda multiple opportunities for the grantees to talk with each other, to learn about each other's projects, to share some of the issues and challenges that you face in common, to steal from each other solutions that have worked. So we have really designed this agenda to make sure that you accomplish that kind of collaboration among colleagues. Because, in fact, what I think is unique about this program is that we are not just about advancing science for impact. We are vitally interested in building a community of scholars, a group of people who share a mission in common with each other, and who share it in collaboration with tremendous stakeholders. So this time has been set aside for you to accomplish this. You're also going to have the opportunity to begin to think about, especially the finalists and the other grantees I know have thought about this a great deal, about how your work feeds this bigger picture agenda. And toward that end, a key hallmark of our program has to engage stakeholders as well as members of the National Advisory Committee in the conversation with you. They're here to help you shape your proposals. They're here to enable you as you're going through your studies to address some of the challenges. And they're certainly here to help you disseminate your work. And so what I'd love to do is to introduce the members of the National Advisory Committee and other stakeholders who are here today. Linda Burns-Bolton, as I mentioned, Vice President for Nursing, Chief Nursing Officer, and Director of Nursing Research at Cedars-Sinai. You want Linda? So everybody can see you. Yes. Laura Karamonica, who is Senior Vice President, Chief Nursing Officer at Westchester Medical Center. Laura? Randy Krakauer, who is the National Medical Director of Aetna. Hi, Randy. Jose Pagan, Professor, Economics and Finance at the University of Texas Pan American. Shelley White-Means, Professor and Director, Consortium for Health Education, Economic Empowerment and Research at the University of Tennessee, Memphis. Jerome Allison, who is co-editor-in-chief of Medical Care. Kate Bent, who has a new title this year, Chief of the Center for Scientific Reviews, Healthcare Delivery and Methodologies Integrated Review Group. It grew longer and longer and longer at the National Institutes of Health. That's terrific, and congratulations. Leah Binder, who is CEO of Leapfrog Group. Our very special guest today, Bob Brook, Vice President, Corporate Fellow, Director of the Health Program at RAND. Hi, Bob. We'll be hearing a great deal more about him when he's introduced. Esther Emard, Chief Operating Officer at the National Committee for Quality Assurance. Bill Evans, who's editor of the Journal of Human Resources. Mary Beth Farquhar, Managing Director, Performance Measure Development at the National Quality Forum. Mary McDonald Hand, who's a Health Scientist Administrator at the Agency for Healthcare Research and Quality. Katarina Keefe, who's Co-Editor-in-Chief of Medical Care. Holly Pittman, who's the Executive Vice President at Academy Health. We'll clap in her absence. I'm sure she'll be joining us. She was a big part of this launch yesterday. Susan Reinhardt, who's Senior Vice President at AARP. And Nancy Shute, who is the Senior Editor of the U.S. News and World Report, who will also be joining us. Terrific. So the last thing I want to say to you is that over the next couple of days, this is an opportunity for you, our grantees, to tell us, your team, of the things that are important to you, and to help us to continue to shape and refine a program. In our first 4 years, our primary authorization was to fund teams in this discovery phase, to develop through rigorous interdisciplinary science some of the findings that will help us to understand nursing's contributions to quality, and at the same time help us to understand opportunities to improve the quality of care delivered by nurses. In the next 4 years, we continue and will continue to invest in the production of important findings that are essential to improve the health and quality of all Americans in this country. But we're also going to be investing a great deal more of our time and energy in areas around translation and dissemination of findings for impact. So this is a very exciting stage in terms of our program. We had last week, in fact, INQRI joined forces with the Donahue Foundation to bring together a number of foundations, leaders of a number of foundations across the country, to help us think through how it is that we could really build on and expand what you're doing so that it will have maximal impact, so that it will reach the people in this country that are so deserving of your findings. And that was a really important time, and we hope over the next couple of days to be sharing some of what we learned in that process. And INQRI representatives were there to talk about their work as well as to participate in the conversation. But we are very anxious to hear from each of you about ways in which we can help you shape your work, help you in your efforts to disseminate and to translate it, because we all share as a community this very exciting goal. And now it's my great pleasure to introduce a treasured colleague and friend, Mark Hawley.